Hi everybody, Dr. Adam E. here to talk about health obviously, and now that it's summertime, one of the biggest passions I had as a child, and still do to this day, and many of you probably share, is the enjoyment of amusement parks. You know, being able to ride on roller coasters, going on the fast rides, and things of that nature. But I remember growing up that there were a few roller coasters each year that I just didn't meet the mark in height and couldn't wait to the next year. But nowadays, people are reaching the mark of height, but what they are overreaching is the weight restraints and limits on these rides. Just recently here, I just read that at the Wizarding World of Harry Potter, on one roller coaster, if not a few different rides in the park, that people have met the restrictions on height, but unfortunately are too overweight to actually ride these rides because it goes above and beyond safety standards. Couldn't imagine that, especially if you're a parent bringing your kid to the amusement park and they're just too overweight, or you're too overweight. This is an alarming trend. Since over maybe just the last 30 years, the average weight of an American man has gone up over 30 pounds. Now, the continuing rise in obesity has caused these huge trends, and we don't want people to miss out on fun, but this is your health that's at stake, not just a ride on an amusement park ride. In some areas, even in Disney World, they had actually had to change the specifications of many of their rides over the last 5-10 years due to overweight passengers. The ride The Small World actually was getting continually stopped by overweight passengers. Now, my recollection, I could maybe only withstand one ride on that ride, not alone being stuck on it for a half hour, 45 minutes with those little kids singing. But needless to say, take your health and ownership of your health and move into a great direction. And don't let an amusement park ride be the tipping point to start taking care of your health. One of the big things that we're always focused on here is teaching you and alarming you to the dangers of the medical system. Not to say that the whole medical system is bad. They can save your life in a crisis. But a good friend put together an article that is worth hearing, listening to, and obviously sharing with other people. And it's called Just One. Just to start off here, Harvard University found that just taking one aspirin or Tylenol each day will cause an 80% increase in your risk of heart attacks and cancer. Just one a day. Many people pop these pills on a daily basis thinking they're safe. Just one pill of Vioxx for 5 days of starting that medication increases your risk of heart-related death and cardiovascular disease by over 70%. The University of Washington found that taking antibiotics increases your risk of cancer. And for parents, and especially children out there, just taking one round of antibiotics doubles your risk of asthma. And then to think about the subsequent future doses of antibiotics dramatically lower that immune system and increase your risk of both asthma and allergies as well as other autoimmune diseases because of the destructive nature of antibiotics on your immune system overall. They know also taking one aspirin a day, especially over a period of time, increase the risk of pancreatic cancer significantly in women, and this disease itself is fatal over 90% of the time. Another big thing is just taking one Crestor pill to supposedly lower your cholesterol levels have been shown to cause a 75% times level of kidney disease than other statin drugs. Which, if you pay attention to that, means that it just causes more kidney damage than the other statin drugs, which means all statin drugs cause kidney damage, as well as known liver damage, which they test for during continual medications on these cholesterol-lowering drugs. One vaccination can leave your child brain damaged or on the spectrum of autism. Just one vaccine containing mercury increases your child's risk of autism by over 27 times. And they're telling you they're taking this mercury out, but there's quite a few out there, including the flu shot, that still contain mercury in them. They found that just taking one painkiller, an NSAID, in hospital situations can cause death alone. A big thing also is taking cough suppressants. Many of them have now been banned because of their increased risk of strokes, and not only in adults, but especially children, just after one dosage. That's how dangerous these drugs are. Also, the LA Times, also back on the topic, found that antibiotic treatment has never really been an effective treatment for sinus infections, that the recommendations now to doctors are watchful waiting, that after about 3 or 4 days, a majority of these sinus infections, ear infections, clear up on their own. Because ultimately the best doctor is inside you. It just needs no interference. And continual antibiotic treatment not only interferes, but damages your body over time. So really moving forward, focusing on that just one, what if we focused more on the just one other person that could hear the amazing potential for health, especially under chiropractic care? We all have friends and family members that we know subscribe or prescribe themselves to that medical model continually, popping pills daily for aches and pains, or on cholesterol drugs, or heart medication, or diabetic medication, that these people really have been over-medicated but under-serviced. No one has really taught them the truth about health and healing, and we do not want them, nor you, to wait for the heart attack or the stroke, or even the cancer, to make that dramatic shift in line of your health. Whether it's not being able to get on the roller coaster, or ending up in the emergency room. We want you to take ownership of your health, but we want to spread it to just one more person, let alone not just our whole community, just one more for you. So this week, this Wednesday, but throughout this week, Patient Appreciation Day and week is what we're focusing on, changing and saving not only your life in this office, but allowing friends and family members to have the availability to come to us and for us to sit down with them to go over their health concerns in detail. Most people are in a dark place in their life. They have no hope, or they've been sick and tired of being sick and tired, and this is our chance to reach out to them through you. You can truly be a blessing to other people by reaching out to them. So before you go, even while you're doing your exercises right now, think of just that one extra person who won't be just doing that one extra thing of medication to their body, but possibly doing the one thing that could change their life forever. And bring their name, their phone number up to the front desk. We can call them and contact them. Even if they cannot make it this week, we'll still honor the availability for them to get to the office so we can help reach out to them and change and save their lives. Make sure that you also look up and look towards any of our upcoming events and sign up for those. The patients that always have gotten the best results in this office attend our workshops, seminars, and free seminars to go over health and wellness to teach you to get back to amazing health, as well as grab yourself a health tip this week for yourself to go over this life-changing information, but also to pass it on to others. So we want to be here to support you, obviously, through your continued journey back to amazing health for you, your family, and your loved ones. Once again, today, before you leave, think of just that one person, write down their name, their phone number. We'll contact them, and they will thank you. There are miracle stories all over this office. In fact, you're a miracle waiting to happen. In fact, your miracle may have already happened, and we're so excited to continue to watch your progress and growth towards abundant and amazing health. So continue to be prosperous, follow all the guidelines, eat well, move well, think well, have a blessed week, and we look forward to seeing you soon. Take care.